One of the state's largest healthcare providers is slashing its workforce. Integra says it's because of federal cuts to Medicaid and Medicare. News 4's Sydney Batzloff tells us what the cuts will mean for patients and their providers, and then she'll join us after for the breakdown.
It is very unfortunate. It's disheartening, dismaying that this is happening.
Doctors across Oklahoma reacting to these cuts. Integra says over the next 3 to 6 months, they'll be reducing staff or closing some clinics altogether. The reason? Cuts to Medicaid and Medicare included in the so-called One Big Beautiful Bill signed into law last July by President Donald Trump.
If you're a hospital and you realize that that Medicaid is a significant revenue source, and if that revenue source goes away, it's very difficult to pay physicians.
Once fully implemented, Integris officials say they expect a net revenue loss of $130 million each year. We also reached out to Mercy Hospital. A spokesperson tells us despite the One Big Beautiful Bill's $6.7 billion in healthcare funding cuts to Oklahoma, they have no plans for closures or staff reductions. But add these cuts will, quote, will do additional financial damage to hardworking Oklahoma families. Oklahomans should make clear to our elected officials that these cuts and their drastic impacts to our healthcare system are unacceptable.
We have a high level of poverty compared to other states, and our citizens rely on Medicaid for health care.
Dr. Sumit Nanda, past president of the Oklahoma State Medical Association, says federal cuts along with state changes to voter-approved Medicaid expansion could have a big impact, especially on rural hospitals.
They have large amounts of debt. If their revenues get cut off further from Medicaid being rolled back, I cannot imagine that these hospitals would be able to remain viable.
And joining us now for the breakdown is News 4's Sydney Batzloff. Hi, Sydney.
Hey, Heather.
So when talking about changes to Medicaid expansion for our state, who do doctors say will be most impacted by this?
Yeah, so when we're talking about Medicaid, the people that rely on Medicaid in our state the most is our children and also pregnant women. So those would be the patients impacted by that. And they said, I mean, for providers, think about your family practitioners, OBGYNs, anyone that works with children. Those are the providers that would be impacted most by that Medicaid expansion.
And so talking about the Integris cuts, you talked to someone who was laid off or will be?
Yes, I did. So she told me she found out on Thursday when she went to work, found out she was being laid off. It's not going to go into effect for a couple months, but this woman is actually pregnant. So, I mean, you already think about losing your job, then that added stress on top of it. I mean, she's going to have to find a new job. With that
Health
comes
benefits,
insurance changes,
yes.
And in the middle of a pregnancy, having to switch doctors. So, I mean, a lot of added stress for her and her family, and she's not the only one.
Well, speaking of that, do you know how many people will be laid off?
I reached out to Integris today to try to get some more information because their statement didn't give us a number of how many. They didn't get back to me, so we're not really sure how many. The lady that I talked to, though, she said that she was made aware that whole departments were let go during this process. One of those was pediatric neurology, something with dermatology. Those are just some examples that she gave me.
How about impacted patients? Have they been notified?
So Integris told us they're going to be sending out letters to patients, and that will happen within 30 days of a practice clinic shutting down. So I'm not sure if anyone has gotten those notices yet, but they're supposed to be on the way.
All right, Sydney, as always, thank you. We appreciate your help and your insight on that. Still ahead, a former